video is to demonstrate how to perform a caudal epidural or sacral coccygeal block in a cat. We use this procedure very commonly in cats presenting with urethral tract obstructions, as it helps to aid urethral relaxation and provide regional anaesthesia to the perineum, penis, urethra, colon and the anus. And it does that by blocking the pudendal, pelvic and caudal nerves. There was a recent paper in JBEX 2018 that showed that this was a safe procedure that helped to reduce intravenous anaesthesia requirements in cats. The way that we do this is we have the cats in sternal recumbency, and we basically palpate the space between the sacrum and the first coccygeal vertebrae, or the first and second coccygeal vertebrae. And you can see in this video here that we're doing that by basically putting some pressure sort of in between the joint spaces of the spine and moving the tail up and down. And the most mobile joint in that region is going to be the right location. So that will generally be your sacrum, between the sacrum and the first coccygeal vertebrae. So what we do is we use a 25 gauge needle that's 1.5 inch, and within that syringe, 1 ml syringe is basically 0.22 mg per kilo of bupivacaine. And that typically works out between sort of 0.2 to 0.3 mils per cat. So as you can see, we've located our most mobile joint, and then we're introducing the needle perpendicular to the spine at about a 30 to 45 degree angle. You advance the needle through the ligament flavum, so you'll feel a little pop as that happens. If you hit bone, then you can just walk the needle sort of forward and backward, as you can see in the video. Once you feel you're in the right location, then aspirate backward, and if you're happy that there's no air or blood, then you can slowly inject in. And generally we find that this is a very, very well tolerated procedure. If it has worked appropriately, and it works in about sort of 70 to 80% of cats, then about 10 minutes later we should find that there is sort of reduced tail and perineal responses there. And the bupivacaine alone can provide good analgesia for about a 10-hour period in most cats. So just a helpful procedure that can help to reduce the need for rescue analgesia in cats with urethral obstructions, and something that we use quite frequently here at Cat Specialist Services.